Good morning. I am your host, Kathryn Watson, with the Scrubs and Stethoscope podcast, the Nursing Handbook. I am here with Ashley Roberts, and today we're going to be going over Awareness of Month, and we have chosen endometriosis because this is very personal to both of us.
Mhm.
If you have any comments or anything, we want you to put them in down below. If you like this podcast, give it a thumbs up. If you don't, give it a thumbs down and leave your comments. So the questions I have today for you, Ashley, is can you explain what endometriosis is and why is it often challenging to diagnose?
So endometriosis occurs when tissue that's similar to the endometrium is found outside of the uterus. So it's not actually that endometrium lining coming out of the body. It's similar to it. We used to think that it was simply that lining, and there was this theory of retrograde menstruation, but that's pretty much been debunked at this point. I think most specialists no longer buy into that theory, but because of that, we really don't know what the cause is, but we know that's what's occurring inside the body. And so those pieces of tissue deposit elsewhere in the pelvic cavity, although they actually can be found anywhere in the body. The endometriosis has been found in every major organ of the body, including the brain. I think
Yes.
it's only about 5 cases of the brain, but it's there.
Yep.
Um, so what happens is they deposit there. They're producing their own estrogen, so it's independent of what's happening during your cycle. Yes, when you get your period and when you have ovulation, they're irritated, they get worse, but the endometriosis isn't it's not completely linked to just the period. So many people end up getting symptoms every single day. It's not just a bad period. So that adds to the complexity of how do we diagnose this, because it does kind of look different for every person. So even if you have all those textbook symptoms, it often gets
What are
misdiagnosed.
some of the symptoms that you're talking about, like severity of it? Because I
Yeah,
know a lot of
so
people are going to have questions because, like you say, if it's everywhere in the body, what are some of the symptoms and the terms of it? And how do we go into maybe current treatment options for it?
yeah, so one of the main symptoms, one of the things people think of the most when they think of endometriosis, if they even know about it, is a painful period. And so I think as young women, we're taught that our period is supposed to hurt, or it's okay that it hurts because that's normal. And the truth is, it's actually not normal. Your period isn't supposed to be hurting you. Maybe it's not the most comfortable experience, but it is not supposed to make you lie in bed all day at the age of 13. You should, that isn't normal.
Mm.
So we see these really horrible pelvic cramping, heavy bleeding, painful urination, painful bowel movements. Sometimes you'll see young women, or even as they age, getting recurrent urinary tract infections. It's not necessarily something going on just in the urinary tract. It could be endometriosis. And you'll also see women that are constantly going to their primary care doctor or urgent care, like, I think I have a UTI. It hurts when I urinate, all this. And they're negative, and they keep having these symptoms and nothing's helping them. Well, years later, they find out, oh, I have endometriosis. I never had all those urinary tract infections. This was something else. Um,
Mhm.
uh, Painful intercourse is a symptom. Um, Let me just refer to my notes because I'm drawing a blank. I wrote everything down.
I would just say too, is it how long does that take sometimes? I know that it can take a while, right?
Yeah, for diagnosis, unfortunately, it can take a long time. The average is 8 to 10 years. Um, But that can really vary. Some people are fortunate to get diagnosed earlier, within 3 years. And for me, it was 20 years. 3 years still sounds like too much to me, though. 3 years of pain for unknown reasons is a lot. Some of the other ones that I missed that are, to me, a little obvious, fatigue and bloating. So that can be a major component here. Is there's something called endobelly. And so you can be super healthy and super skinny, and no matter what, you have this gut because you have so much bloating from your endometriosis. So that is also a major indicator. But a lot of these women are diagnosed with IBS or, other conditions that they don't actually have, or are just contributing to the underlying problem. So it makes it challenging. I think one of the biggest hindrances to diagnosing endometriosis is it can only be done in the OR. There's no test that we can do to say, oh, you definitely have endometriosis. So how many doctors are doing that? You know what I mean?
Mm-hmm.
You can do an ultrasound, and if there's a very large endometrioma, maybe it'll show up on there if it's not hidden by another organ. But even an MRI, if it's negative, it does not rule out endometriosis. And sometimes you do an MRI and see all this endometriosis, and then you get into the OR and it wasn't even in any of those spots the imaging showed. Yes, it was there, but it's not like the map that they wanted it to be. So oftentimes, as I've talked to other women, they're like, oh, I don't know if I want to go see a specialist because all my tests have always been negative. No, it literally means nothing, unfortunately. So I think that
Is
adds
there
a big
anything that
challenge.
we can treat it? What kind of treatment is there for this?
So the main way to treat it is back in the OR. So, you kind of get diagnosed and treated at the same time. So excision surgery is really your best bet if you're looking for relief, and a confirmation of your endometriosis. If you are suspecting it and your regular gynecologist wants to do an exploratory lab, proceed with caution. Unfortunately, regular gynecologists and other physicians aren't necessarily trained adequately in endometriosis. So for me, I was taken to the OR and told, you absolutely don't have any endometriosis in there. And then I saw a specialist and was diagnosed with stage 4 endometriosis. So I think that's just proof that going to a specialist, in my opinion, is your best bet because they're going to do the excision surgery. The one thing I'll say, I wish it didn't take me 20 years to get diagnosed, but had I been diagnosed properly in that initial surgery, I would have gotten ablation surgery. I wouldn't have had excision. And ablation is basically burning of tissue. And that's problematic because one, it can actually cause more problems. You can get carbon staining from the burning of that tissue, but also then you lose your ability to confirm it with pathology. So after my excision surgery, from every single lesion that was removed from my body, a biopsy was sent to the lab. Every single biopsy came back as endometriosis. So a lot of people will say like, oh, this is a diagnosis of exclusion and it's not a real disease. No, it is because there's actually pathology to prove its existence. So I think that's another misconception about it. But, I think surgery is scary for a lot of people.
I was just gonna say that I sometimes like the way you're talking is just like jumping into surgery. Is there any medications that someone can take to help maybe suppress all this? Because I know some people would be really scared to have a surgery. And I know when I was diagnosed, I wasn't diagnosed until I had surgery too, but what prompted the doctor to do it is because I started having cysts. I had cyst on my breast, I had cyst on my ovaries. And I had no idea that's what I had until I woke up from the surgery.
Yeah.
But then they're sitting there saying that you can take certain medications. So what medications are there?
So there's a lot of, I don't know what I'm trying to say, but the medications come with a lot of side effects and they're not proven to be effective. So sometimes they're great for symptom management. The problem is, so one of the medications, Lupron, you can give that to suppress endo, but there's no proof that actually suppresses it. So you're taking this medication, it's causing you severe side effects such as severe osteoporosis, hot flashes, fatigue, things that are debilitating to treat something, and it might not even be treating it. So it could be growing in there and you don't even know it.
Right.
And a lot of times you're treating the pain and you're not treating the endo. So pain is an indicator that something's wrong, right? So if you take
Yes.
away that pain and you hide it, how do you know that something's going on? So that endo is having the chance to like go here and go there and get bigger and have nodules and cause severe problems, and you don't even know it's happening because you're suppressing it. But you're really just suppressing your symptoms and your pain and causing side effects that are pretty severe. For some people, birth control is an option. You have to use caution on what one you choose. I didn't know that when I was younger, and I was on a birth control, the combined oral contraception, and it's not necessarily the best choice in someone that has endometriosis. I continued to have horrible cramps, heavy bleeding in between my periods.
I had the same problem. I didn't even know I would have the pelvic pain during my period and always feeling like I needed to sit down. And then they're like, you have inflammatory pelvic disease and all this stuff. And at that time, they're the only way to manage this is to be on birth control. But they don't tell you the side effects. And one of the biggest things I want to put out there for everybody is like, if you are a smoker, you need to stop because you put yourself at higher risk for having strokes. With all this too is they question to say this is a hormonal imbalance within the body kind of thing. And that's why a lot of people go undiagnosed for so long, because the birth control suppresses everything. And when you're on birth control, you don't get a full period. Some people I know don't even get a period at all. And that's why they have no symptoms until you get older. And maybe you decide to start having a family and you're going to go off the birth control. And that's when all the symptoms and everything starts and you go down that journey, because it takes 6 months before you can go to a fertility clinic or go anywhere and see a specialist, because you have to do the diligence of going through the steps of what the doctor tells you. That's why we're trying to bring this to awareness, especially the end of this month, to say that you're not alone. We're here to help and speak up. And if you know someone, so this is where I want to kind of change gears a little bit. And like, how has endometriosis affected your daily life, such as your work, your relationships, and even the biggest thing that I want to go back to is your mental health. Like we sometimes as women think we're going crazy. And when you talk to people, they're all like, it's just your period. Where this is where we say it might be in the brain and we have to come back. So how has it affected your daily life?
So I remember the day that I had my post-op with my gynecologist, and she sat me down and said, you have absolutely no endometriosis. I don't know why you can't handle your period. If you can't handle it, I'll just stop you from getting it. And she put me on continuous birth control, and she silenced me that day. And it was to the point where my husband didn't even know I was in pain every single day, because this happened before I met him, and I had learned to shut my mouth. I knew that if I continued to report this pain and continue to want to investigate it, I was going to get that crazy label. And I didn't want that. So I just dealt with it. But that meant feeling exhausted all the time because I was pushing through that pain. I was going to work in pain. There was times where, and I mean, I'm not someone that called out often, but there were times where my period was so painful and so heavy, there's no way I could have gone and worked on the floor as a nurse. I couldn't even take care of me, never mind 5 other patients. So I had to call out, and that felt horrible. And then that, there was times where I called out and I knew I was getting judged for it. And that adds to that feeling of inadequacy. Like, I remember feeling like, wow, I'm pathetic and I'm lazy and I can't believe I can't handle this. And for me, mine became so advanced that I actually had pain up into my rib cage. There was a lesion pressing on a nerve up into my rib cage, and I'd get shooting pain down the left side of my rib cage. I'd also get pain down both my legs. And it was so horrible. And I think you live with it for so long, and it gets a little worse, and it gets a little worse, and it gets a little worse. So you don't realize it.
No.
Then you don't have pain anymore, and you're like, this is what life is supposed to be like.
That's how it's funny. I know exactly how you feel. So it's like, I had so much pain, discomfort.
Yeah.
I woke up from my surgery and I turned around and be like, I don't have those weird pains, twinges or whatever. And you're like, I feel great. It's weird. And the label of you're crazy and stuff. I can remember I was at work and I didn't even know my period was going to come. This is the hardest part. We always have stuff in our bag as women just to make sure. But I was at work. I was doing something with the patient and I stood up, and that feeling that you get as a woman. And I was like, oh my God. And I went into the bathroom, and then I'm sitting in the toilet and I had to call. We have our little phones, and I called the
Yeah.
secretary, and I was just like, help, I'm in the bathroom and I'm stuck. So she
Yeah.
literally had to go get all the stuff that you need for women. And then she went in and got me some extra scrub pants to put on to finish my day. But that, it's like, you don't know, because your cycle sometimes can be normal, but it also can be off. So that's where I want to bring the attention to your menstrual cycle of your days. There is wonderful things on your phone now that you can track your period. And one of the things that they notice is that your cycle is irregular at certain times. So we try to say is that, like, if you're having your period every 26 days, that is not a normal. And if you're going more than 30 days, not normal. You have the average between 28 to 30 days. So 1 month cycle. If your cycle is off, your hormones might be off. And that's why we say that you should start talking to your GYN and having these conversations. And then from there, then you go into other treatments. And that's maybe the end would be the surgery and everything you're talking about. But this is where we want to bring an aware to women of all ages of just tracking your cycle is a start. And then writing down your symptoms of what you're having, your whole body. Because yes, we don't want to sit here and label anybody to say that you're crazy because you're a woman. And we hear that a lot from men. That's the sad part, because they have no idea of how we're feeling. And like you said, I started doing the same thing of not telling anybody.
Yeah.
Dying in pain. And I think that's the nurse in us, because we're so used to taking care of everybody else that we put ourselves on the back burner. Like, I'm in pain today, but guess what? This person's in a hospital bed or whatever we're dealing with, and they're a little more sicker than us. So I can say relationships too. If you're feeling pressured to have sex with your partner in some way and you're uncomfortable, first being in the situation, you need to speak up. But if you're uncomfortable during, after, or whatever, that is something why we're here to talk about. And we want you to bring all your concerns to us.
Yes.
So I kind of want to move into like personal journeys, because I'm going through it all right now of learning about myself and where I'm allowing to what's going on in my body and be okay with it. I went through the whole IVF treatment in my 30s and tried to get pregnant and everything else. And then it became a stressor between me and my now ex-husband. And it kind of tore me apart, where other people, it might bring you together and the journeys of it. And I know if you want to share this with everybody, like your personal journey. So would you be willing to share your personal journey, like with us, about your IVF experience?
Yeah. So I just want to say a little bit about early on before that. So my symptoms of endometriosis started when I was only 13, and they were pretty severe by 17. I was almost passing out by the age of 20. And that's when my mom actually went to my doctor with me, which I feel kind of silly at the age of 20, but she saw how much I was suffering and no one was listening to me. And so she went there with me, and she was like, I know she has endometriosis. And the doctor labeled both of us as crazy and then reluctantly agreed to do the surgery. So then fast forward to getting married, getting off my birth control, wasn't getting pregnant. We went to an IVF doctor. I had told that doctor that, I had already been ruled out for endometriosis. She not once told me that, regular gynecologists miss endometriosis. I guess that's common knowledge in the IVF world, and no one shared that with me. Instead of listening to my symptoms, she told me, I don't know why you were even tested for endometriosis. You don't have endometriosis. It sounds like you have a bleeding disorder. Okay. She didn't test me for any bleeding disorders, though. That consult didn't go well. We took about a 10-month break from IVF and went back that April, saw a different doctor. I had some lab work done, and my AMH, which is the anti-Müllerian hormone, it's an indicator of ovarian reserve. So in June of 18, that level was, or sorry, June of 17, that level was 3.4. By April of 18, so 10 months later, it was down to 1.17. And I was like, oh my, how does that happen? And they kept telling me, well, it's still a normal range. They're not worried. I was like, yeah, but I don't think it's normal for in 10 months it to drop that much. And I just kept being told, don't worry about it. Don't worry about it. That was the endo that did that. The endo was taking over my body, and it did that. So we proceeded with IVF. We were super lucky to have success early on in that process. We had one canceled cycle along the way, but that got us to our son. And so we were so excited, and you kind of feel on top of the world when it finally happens. But then I still had pain, and after I had my son, I had symptoms that we don't know if they're related to endo or not because we don't know enough. But during my pregnancy, I had bleeding, and postpartum, I bled for a whole entire year until I finally had a DNC. And so everything just felt off. Nothing felt quite normal. My periods hurt as much, maybe a little bit more than they did before I had my son. And it just kept being a problem to the point where I'd get my period and I'd be vomiting from the pain. I'm someone who's had kidney stones and went to work, but I can't handle my period. And so obviously something's wrong. So I actually turned to Facebook because I wasn't getting anywhere with anything else. And I found this group on Facebook called Nancy's Nook. And through them, I learned, this is where I first learned that regular gynecologists miss endometriosis. And I was like stunned by that. And I was stunned that despite having, I had every classic symptom of it, every single one of those symptoms of endometriosis. And it was taking me going onto a Facebook group to figure this out. That was really hard to accept as a nurse, especially. But I met some wonderful women there. I found a second Facebook group that's intended for the greater Boston area. And I found a surgeon that was just so amazing. And I remember my first consult with him, walking in there so scared, not knowing what to expect, thinking like, this really just is all in my head. Everything's fine. I'm crazy and I can't handle my pain because I'm weak and lazy. And I walked out of there for the first time in my life having my pain validated. And he was like, I absolutely think that you have endometriosis. He's like, it's not a question of whether or not you have it. It's a question of how much are we going to find. So I got on a wait list, and I was supposed to have surgery this coming August, which I was like, oh God, I don't want to wait that long. But I got off the wait list, and I had surgery at the end of last year. And I woke up to find out that I had stage 4 endometriosis, and it was everywhere. And all my symptoms could be explained by endometriosis. So it was a very long journey. And that's where I'm at now, because it's so frustrating and it causes so much anger. But I know that having that anger inside me isn't going to help anything. So what I want to do is help other people. I want to channel all that anger into making this better, because it never had to happen the way it happened for me.
Right. So in your opinion, what can be done to improve the awareness and the understanding of endometriosis among the general public? So we know a little bit more as being nurses and not even that personal experiences. But how can we have other people be more aware of it and understanding of it?
I think that's multifold. So I think it starts with medical school. Do you know that most medical schools don't teach on endometriosis, or they might have like a couple sentences in their book, maybe a couple pages if we're lucky. They really don't learn about it. These specialists go to fellowships. They are trained in how to treat this. Years of experience before they're on their own. It's a very delicate surgery. Endometriosis, when you're in school, medical school, NP school, whatever, it's taught it is this. It is only this, and it only looks like this. But the fact is, it's this, 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 this. It doesn't all look the same. So you
Hmm.
can't just say, oh, you don't have any, when you don't know what you're looking for. So
Right.
I think that it really starts with education of professionals, mainly in medical school, because most nurse practitioners aren't going to the OR, at least they're not leading in the OR. So I think the fundamentals need to be taught across the board in school, whether it's medical school, NP, PA, but especially any surgeon who wants to go into GYN, I think that they need more training. There aren't enough specialists right now to do excision surgery on every woman. I would love to refer anyone who I think has this to these amazing doctors, but they're already booking over a year out. So that's not practical. So we need to do better.
Yes.
Aside from medical school, I think having women like us speak up and talk about this is,
Mhm.
I'm hoping, really going to help other women. I hope someone sees this and reaches out to us, or reaches out to the Facebook page, or calls the doctor because of us and gets relief from her symptoms, because that's really what I'm doing it for. And
Yes.
then as a society, I think we need to end the stigma. Like, a period doesn't have to be disgusting. We need to also realize a period shouldn't be painful. And then lastly, it's so important to do more research on this, because we're just at the surface level here. We really don't know enough yet. And it's hard when most of the studies that are done thus far are done by pharmaceutical companies. That's biased research, in my opinion, because we've seen what this repression therapy and various pharmaceuticals can do. We need unbiased research that can really get down to the nitty-gritty of what's going on here, so we can develop other ways to hopefully diagnose it and treat it. I think the OR is always going to be a component of that, but it would be really great to be able to properly diagnose someone without the OR, or at least have, I don't know, provide something more for the patient to know that they're making the right choice by going to the OR. I felt like I have nothing to lose. I want to do this. I need to do this, but not everyone feels that way. So I would love to give women a little bit more so they can be comfortable in that choice.
Yes. And that's why I'm excited to let everybody know that we are creating like a course to help educate all nurses, and not even that, the general public,
Mhm.
about what it is about endometriosis, about your period, about your body. And it's going towards all ages. So if you, in the future, educationalnurse.com will have this course on there. And where I said we have a private community where you can come in and ask any of your questions that you need to be answered. We have this Facebook, Nancy Snook, who has been very educational for
Mhm.
us. But we just want to bring it into to say that there are courses as nurses that we can teach you what to look for and what not to look like out for. So
Yeah.
that's coming in the future. So I want everybody to look out for that.
Yeah.
And we're excited. Like I said, leave your comments down at the bottom, any questions that you have, and we'll be happy to answer any of them. Is there anything else that you want to add at the end to give out to everybody?
I'm just, I've been excitedly nervous about this, and I'm excited to do this and help women, and I just want people to know that we're here to support you. This is what we want to do. We want to make it better.
Yes. So as I said, give this a thumbs up or thumbs down. Leave your comments below. You'll find us at educationalnurse.com for the start. As I said, I have the new nurse navigator for the new nurse for transitioning from academia into the bedside, and we give you tips. Then we have the documentation, which is led by me, the legal nurse, to give you more insight. And then we have the mindfulness meditation, the nurse harmony, and that's where we go into talking about the mental illnesses that people kind of put labels on us, and how we can help you get out of, I guess, that norm of saying that this is normal, where we know that this is not, because everybody is different. Every woman is different. Every person is different. So we just want to say that we're here for you. I want to say thank you for joining us. And thank you, Ashley, for sharing your personal stories. And
Thank you for
we'll see you
having me.
next time.
Right.
Great. Bye.
See?